do, I'm going to introduce Meredith Uhas. She is the Director of Mental Health and Wellness at CT State.
Great,
Oh.
thanks. Thanks, Alexa. I'm so excited to be here, and I really look forward to developing the mental health and wellness services across all the campuses. And to hear more about that, I'm going to have my own upcoming webinar, so look for the date. But today we're just going to focus on that one component of our services, but a very important component to our service delivery model, and which is our partnership with TimelyCare. So we're very lucky today to have Andy Fenton with us from TimelyCare, and he is going to talk all about the mental health, wellness, and the medical services that are available to all of the students across all of the colleges. So I'm very excited to have Andy here. Welcome, and thank you so much.
Thanks so much, Meredith. Appreciate y'all having me. And I have had several opportunities to connect with different schools and individuals across the Connecticut State Community College system. And just want to say, first and foremost, thank you all, not just for allowing me to come and share with you, but also just for your partnership. The groundwork that we laid with Connecticut, just to give you a little bit of background about our partnership with your system, has laid the groundwork for a number of other opportunities for us to work with community college systems in other states. You were the first community college system that we had the opportunity to work with, and we learned a lot, and y'all have been just great partners in that sense. And so we really do appreciate that. So we will go ahead and get started here. I've got a few slides to share, but one thing I did want to note as well is that as I'm talking, I will make space for any questions that come up. So please do interrupt me or throw something in the chat. I want to make sure that y'all have the opportunity to be heard and get your questions answered. So I'm going to go ahead and share my screen. Here, make sure I get the right. There it is. All right, there we go. So as we get started here, one of the things that, oh, it's not the right thing. Did that go away? What just happened? Sorry.
I see you again now.
Yep. Something is I got two monitors up here, and sometimes when I switch from one to the other, they'll get funky. So let me try this one more time.
Okay. There you go.
There we go. Okay. So as we get started here, I just wanted to point out that, there's really kind of two takeaways that I always focus on for these presentations. One is I want to make sure that by the time we're done talking, that you know exactly what is available to your students. So what are the services, what are the features that students have access to through TimelyCare, so that as you're talking with students, you're hearing from them the concerns they might have, the challenges that they're facing, that when is it appropriate, or to send them our way, or when it might they be best benefit from having access to TimelyCare. And then the second piece of it is knowing how to get them connected. So making sure that you have at least a basic understanding of how students will navigate to TimelyCare and get connected, because that's really important. A lot of times the biggest challenge that students face in terms of receiving care is just knowing how to get there. And it is very, very simple, but again, just equipping you all with some details about how to get students connected and what our platform actually looks like. So you can see here right here on the screen, there are essentially two main ways that students do get access. They can download the TimelyCare app. We're in both the iOS and Android app stores. So students can go there, they can download and log in directly from the App Store. But we also have a website dedicated just to Connecticut State Community Colleges. So if you go to timelykare.com/CT-State, it will take you to a login page where you can get connected there. And again, with either of these, it's important to know that right now only students are eligible. So as a faculty or staff member, if you go to either of these places and try to log in yourself, you will be blocked from being able to log in. But again, students do have that access, and that's why we want to make sure today that we give you that overview so you know what it looks like, since you can't access it yourself. One thing to note too is that in terms of how students are accessing the platform, we are tied into the system's single sign-on directory, which basically means when students access TimelyCare, we're determining their eligibility in the same way that you all would in terms of, is a student registered for classes. So as long as they're registered for at least one class, they have access to our platform, and that's how we know that they're eligible. That's also how they sign in. So they're using their Connecticut State email and password to log in. They're not having to remember any additional emails, passwords, or creating any extra credentials. They're just using those school logins. So With that, the first thing that we're going to dive into is the services. So basically, what is TimelyCare? What are we delivering to your students? So we have a number of different services that are available. One thing that's also really important to note is that students really can access these anytime, anywhere. So just in terms of, they can use the web, they can use the app, but these services are also all available 24/7. So even when students are, after class in the evening, middle of the night, they wake up and they need help, they can access both our medical and our mental health services literally anytime. Right now, our wait times for on-demand services are for the mental health side are under 3 minutes, and for the medical side, it's about 10 to 15. It's a little bit longer, and there's a couple of reasons for that we can talk about in a minute, but really it is pretty quick access. They can get, again, anytime that they need it. The other element is that it is anywhere access. And so while we know that about 95+% of all the visits that have been had so far within your system with at Three Rivers, those visits are happening in the state of Connecticut. But if a student were out of state, they're up in Massachusetts, they're traveling West Coast or in California, wherever they might be, we have providers that are licensed and available in all 50 states. So we are still limited, even though we are a virtual platform, to being able to provide care following federal guidelines, which means that the provider that's meeting with a student is required to be licensed in the state where that student is physically located. So again, in most cases, those are going to be Connecticut-based providers who are licensed in the state. But again, if students are out of state, they're still going to have access to care wherever they may be. So again, just really want to remind you of those kind of things, even as you're talking to students about, what are the important things to know about TimelyCare. It's anywhere, it's anytime. And then the other element here that I wanted to make sure we all remember is that it's free. This is all completely free to your students. They don't have to pay anything whatsoever. There's no copay. There is no paywall. They just get to access the services. That's all covered. The cost is covered through the school. And so there's no need for them to pay anything. They don't even have to have insurance. We don't accept insurance. They just log on. As long as they're a student enrolled at Three Rivers, they have access to these services. So with that out of the way, here are the services that are available to your students. So we'll start on the medical side. One thing that I always like to make sure that we note about medical service is that usually people think, well, online and medical doesn't really seem to match up, right? You go to the doctor, they're physically looking in your ears, they're checking your eyes, your nose. There's that physical element that we usually associate with a medical visit. But studies have shown that about 70% of all medical visits can be handled online. So we certainly know that we can't cover 100% of visits. There's certain things that we just cannot do virtually. But there are a lot of things that we can do. And so I think it's important to remember that there is still value there. And even when something can't be handled virtually by one of our providers on the medical side, it's still a good first stop. If a student's not quite sure if they need to go to a doctor, or they're not sure whether to go to urgent care or emergency room based on their symptoms, these are things that our providers can help them walk through. And so I always recommend, if it's gonna take you, waiting 20 minutes for an ambulance, or driving yourself to an urgent care facility that's 20 minutes away versus waiting 10 or 15 minutes to talk to a doctor on the phone for free, it's definitely worth at least considering that option. So on the medical side, there's two different ways that students can access that. I mentioned earlier on demand, which means that a student wants to talk to a provider right away. So when the student initiates a medical visit on demand, they put in a couple of basic pieces of information about themselves, and then they say, I want to see a provider, and the first available provider will pick up that visit and connect with the student. With all of our visit types, students have the option of either a phone only, so just an audio call. So if they are, for one reason or another, uncomfortable being on screen, they can just do an audio visit. It's also helpful to know if a student is ever having trouble with connectivity issues. Maybe their phone doesn't have a great data plan, or they don't have good connection. They can take our calls via phone. They do not have to be video, but we do offer the video option. And it is about 50-50 in terms of students who opt for the video versus audio. And a lot of times that kind of surprises people that so many students do choose audio. But again, really important for us that we make sure that we're meeting students where they're at. So a student chooses what way they want to have the visit, whether phone or video. Then they go into a queue. As I said, right now, our wait times for medical visits are about 10 minutes. A big part of that 10 minutes is that if you think about, the process of going to the doctor yourself, you go, you check in, you sit in a waiting room, you eventually are seen by a nurse who does the triage. They talk with you for a little bit. And then the doctor, you may not see a doctor for 30, 45 minutes after you get to the hospital, and then once that doctor's there, they're not there for very long. And then the nurse is kind of the one that takes care of you and wraps it up. with our visits, when students are connected, they're connected directly to a doctor or a nurse practitioner. So they're going directly to the individual that's going to help them. And the students have a chart. So not only do these providers see any medication history, any family issues that have come up for that student on the medical side. There's some lifestyle questions that all of our students answer. All that information is available to the provider, as well as any past visits. So if that student has any history on our platform with other medical issues, they can see them. And then they can also see the protocols that your school has laid out for us. And so that's, again, one of these additional ways that Meredith already kind of talked about, and the ways that we collaborate with our partner schools, is that all of our providers, when they meet with one of your students, have a list of protocols and resources that are available to those students at Three Rivers. So again, when a provider picks up the student, they can see their medical history, their lifestyle information, as well as the protocols for the school. And that's really important because a lot of times, as I said, there may be a need to transfer a student to another facility or recommending additional services to them. Well, we want to know, what are the preferred mechanisms for that? Are there specific hospitals or urgent cares in the area that maybe your school has already has collaborations with, or just that you recommend in general in terms of the quality of the service that they provide? Our providers are going to follow all those protocols as they make recommendations to your students. So again, then once a student is picked up in one of these medical visits by a provider, that provider can then, in the course of that visit, work with them to identify the issue. If a medication is required, they can write prescriptions directly through the app. And those we use something called DoseSpot and ScriptSave, which are two different platforms that allow us to write those prescriptions directly to the pharmacy of the student's choice. And then from there, they can just go pick that up. If they run into any issues, we have a team of support individuals that can also help if a student ever needs a prescription transferred to a different pharmacy or anything like that. We also have support after the fact to help them get connected to that. Once a visit is completed, a visit note is created by the provider. So usually within about 10 or 15 minutes of the completion of the visit, the provider is going to fill out a number of fields related to the visit. They're kind of quantitative, as well as notes for that student in terms of a care plan. So for instance, they come in and maybe they're having some symptoms that maybe COVID. They can recommend to them to go get tested, or again, if there's specific facilities you recommend, they can recommend those. Or if it's something as simple as, student, maybe it's not a severe issue, it's just something basic, they can recommend over-the-counter medications that they might recommend. They can also give them exercises or other, activities that might help, in terms of helping them deal with whatever may be going on there. And that information is delivered to the student through the app. Those notes are also downloadable. So a question I oftentimes get with any of our visits is, when a student graduates or they leave school, if they've had visits on our platform, how can they share that information with a primary care physician, a mental health professional that's not a part of our network? Everything is downloadable. And so then they can take that information and share it with whoever else they may be connecting with. So that's our Medical Now service. In addition to that on-demand medical, we also have a scheduled medical. Over 90% of all of our medical visits do happen on demand. Most of the time when a student thinks I need to talk to a doctor, they want to talk right away. But we do offer the option for a scheduled visit. And the greatest value here is that students can choose their provider if they're scheduling a visit. So whereas with Medical Now, they're getting the first available provider, which could be, any gender, any ethnicity, any specialty. If they choose their provider through a scheduled visit, they can go in and see a little bit more information about any specialties that the doctors may have. They can see a picture of the provider, any languages that are spoken. So there's a number of different things that a student can search for at that point to help find a provider that they would feel more comfortable with. Typically with on-demand, with the scheduled visits, students can get connected with the provider within about 24 to 48 hours. So for scheduled visits, they can't schedule them in less than 24 hours. But usually the next available visit is, between 24 and 48 hours away. So it's still not a super long wait time, even if they want to go that route. So I'm going to pause there on medical and see if there are any questions about our medical service.
We haven't had anything come up yet, Andy.
Okay, great. So we'll move on to the mental health side of things. So on the mental health side, there's really two main services that we offer. And we'll talk about the first one, which is Talk Now. So on the mental health side, whereas with medical, pretty much any medical visit, once the visit starts, it's going to look basically the same. It's really just a matter of when it happens, whether it's on demand or scheduled. With the counseling services, with the mental health services, even the way that the visits play out is a little bit different. So Talk Now is our mental health support. So it is our on-demand option for mental health. And students can, with this service, typically get connected within about 3 minutes. So the process of booking an appointment is exactly the same as the on-demand medical. They just choose the mental health service instead of the medical. They go into a queue, and the wait time typically is under 3 minutes for these. So very quickly able to be connected to a provider. With Talk Now, this is mental health support. It is not therapy. And one of the main reasons why we make that distinction is that in order to guarantee that students are getting connected to someone quickly, we do not necessarily have that person licensed in the state where the student is receiving care. So this most of the time is going to be a licensed professional. They just may be out of state. But because they are providing support rather than counseling, it just opens up our options so that we can make sure that we get students help quickly. So in terms of the engagement that students are having, it's still very high value. These are not just trained individuals who maybe have had, a few weekends of talking about, how to support each other. These are licensed, in most cases, licensed professionals. At the very least, they are master's level degree seeking individuals in a mental health field. So again, very, very well-trained professionals who are handling these Talk Now calls. Talk Now also, it's important, I think, to understand that this is not just a crisis line. So certainly if they are in a crisis situation, they really need to talk to somebody. This is a resource that they can use. However, there are any number of reasons why a student might have a Talk Now visit. So if they want to, talk about an issue that they're having with a roommate, they're feeling stressed out about a test that they're having next day, there's nothing too big or too small to use the Talk Now service for. So it's really important. It's not just a crisis line. They can use it for anything that they want. And it's important too to know that all these are things that we've talked about so far are completely unlimited as well. So students can use these services as much as they need to. They call in, they think they've worked through it, they go back to working and they still are stressed out and they want to call back in, they're welcome to do that. A lot of times what will happen is once a Talk Now visit has taken place, if a provider recognizes that there may be a bigger underlying issue that a student needs to deal with, that's where we'll make that recommendation over to scheduled counseling. So we think about it kind of in a progression of care. Talk Now is a great entry point, get students connected, talking, working through their issues in real time. And then if they need additional support, then we can refer them over to scheduled counseling. So scheduled counseling, just like with the scheduled medical, students can choose their own provider. They can choose a day and time that works for them. Typically, we have providers available within 24 to 48 hours. Usually for the first scheduled counseling visit, students do book that about 6 to 7 days in advance. So that is not so much a matter of when providers are available as much as it is that's their preference for booking, is that they might wait a week or so to make sure they find a time that works with their schedule. Also, a lot of times students may not take the first available appointment because the person with the first available appointment may not be a good fit for them. So they can look through a biography of the provider. They can see an image of them, languages spoken, any areas of specialization. So if they're looking for, for instance, somebody who maybe has done trauma-informed therapy, they can find that within the platform. So there's a number of different things they can look at and specialties that they can see about our providers when they're making that choice. Once they choose a provider, they can then see that provider's calendar and book that appointment right there on the line. Scheduled counseling, again, because it is more of that, in-depth therapeutic relationship, these are also longer visits. Talk Now visits typically run about 15 to 20, 25 minutes at the most. Scheduled counseling are standard 50-minute sessions, with the end of those sessions being part of that being scheduling a follow-up. So if a student connects to the provider, they like that provider, rather than having to go back into the platform and find their next session, the provider can actually book that for them right there while they're in that appointment. It goes into the student's account, it's created. If the student runs into issues, they can always reschedule or cancel the visit. But we try to make it as easy as possible to maintain that relationship, because we know that the best counseling happens when a student is able to maintain a relationship with the same provider over time. And in the same way that I mentioned with medical earlier, our counselors, both on Talk Now as well as scheduled counseling, do have follow-up notes that they write to students, so they can provide them with articles and content to help them, in the in-between time. So once they've connected with a counselor, maybe they've got another session scheduled for 2 or 3 weeks out, our providers can give them recommendations for the types of things they can be doing in the meantime to deal with whatever issue they may be dealing with. So any questions around the counseling side of things, Talk Now or scheduled counseling?
Nope, we're still good on questions.
All right, great. So from there, we'll jump over to our health coaching service. So far we talked about medical and mental health. Health coaching is really more of that preventative health care. So these are dietitians and nutritionists who can help students work through eating habit issues, exercise plans, sleep habits. If you think about in real life, a lot of times health coaches are, they can tend to be very expensive. For those adults who maybe insurance covers it, maybe it doesn't. But this is a really, really valuable service. A lot of times, younger folks and students don't think about their health as proactively, and older adults, it's from time to time don't as well. But this is a really, really valuable resource, and I think a lot of times one of our more underutilized services. It is only scheduled, so we don't have an on-demand option for this. But in the same way that our other scheduled services work, students can choose their provider. They can see the areas of specialization, their licensure, and things like that. So again, a really great option for students who are looking to be more proactive about their health. So those are all of our visit types in terms of options that students have to choose to connect one-on-one with a provider. That pretty much covers those services. There are a couple other things I want to mention that students have access to through our platform. One is our basic needs support. So if a student is dealing with additional challenges beyond their mental health, or maybe there's underlying issues related to things like food insecurity, housing, childcare, any of those challenges that students are facing, we have a team of social workers we call our care coordination team that students can connect with. They can make a request directly from the platform, or if a provider notices there may be an issue, they can actually create a referral, a recommendation for one of our care team members to follow up with the student to help connect them to other resources. This is again where we come back to the resources that you all have provided to us. And those are the things that we're going to prioritize in terms of pointing students back. For instance, they're dealing with food insecurity and you have a food pantry on campus, that's where we're going to refer them first. If you have somebody on campus that works with students to help them find affordable housing options, that's the first thing that we're going to do. If the school doesn't provide it, the next thing that we would do is go look in the community. Even in the absence of specific resources that you all have recommended, we're still going to do the legwork to go find the best option for these students to help get them connected to whatever they may need, again, to help, because we know that there's underlying issues oftentimes that are really impacting the overall mental health of our students. And then the last thing here is our self-care content. So I already mentioned this a little bit earlier. When our students are coming to our providers, maybe their core issue that they're dealing with is anxiety. They're only meeting with a counselor maybe once every couple of weeks or once a month. So what are they doing in the meantime to help deal with that challenge? We have a library of self-care content. We have yoga videos, meditation videos, articles, links, different things that students can engage with right within our platform to help them deal with those challenges, the rest of the month or the rest of the week or whatever the time period may be in between those scheduled sessions. So again, really want to make sure that we are creating a well-rounded experience for students to maintain their overall medical and mental health. One thing that I did leave off here, so I mentioned the unlimited nature of most of the services that students have access to. The one thing that is not unlimited is our scheduled counseling. So right now, students have access to up to 12 scheduled counseling sessions per year. That reset, so we're on our second year of our contract with Connecticut, and so that reset on August 1st. So any students that had visits last year, those or prior to July 31st of 2022, those rolled off and they were reset, and so now students have a whole nother set of 12 that they can access. If they do need more than 12, we do have an option. So I mentioned that our services are free. With that 12 session limit, students will have, starting in just a couple of weeks, the option to continue paying out of pocket if they would like to. So if a student reaches that 12 session limit, they have the means to continue to see a provider. The cost is $79 per session. So it is steep, but we want to make sure we've gotten a lot of feedback from our students that, hey, I want the option at least if I've really connected with this provider and I need more help to be able to get it. So again, 12 sessions is generally the limit, but if a student does want to engage with care beyond those 12 sessions, they have that option. And if they don't, again, our care coordination team that I mentioned earlier will work with them and they can help connect them to an in-person counselor in the community. So, if they can find somebody that accepts their insurance, maybe can get them a cheaper option in person, we'll work with them to do that. So that is all of our services. That pretty much covers everything that we have available to students. Any questions about any of the services that we have available?
We haven't got any questions yet, but I think that since we are recording this, if people watch it in the future, maybe we can share either your information or my information so people can reach out to you if they'd like to.
Absolutely. And at the end, the last slide that I've got on this deck has got my contact information in there. So I'll make sure and leave that up for a bit here at the end. All right, so now that we've gone over the services, I mentioned that I have two takeaways that I wanted you to have today. One is understanding what services are available. And I know that right now that may still seem a little bit ambiguous because you haven't actually seen the platform. So that's where we're going to head next. I want to look at what the actual platform itself looks like and how students go through the process of booking an appointment and what they're seeing on their end. So the first thing is, as far as how they get connected, is they need to either go to our website, which is again, timelycare.com. /CT State, or if they leave the CT State off, that's okay. If they just go to timelycare.com, they're still going to get to the right place. But from a marketing perspective, it helps us know where students are coming from if they use the Connecticut specific URL. So just something to keep in mind there. All of the marketing resources that we have for you all have those URLs on them. And so if a student scans any of the QR codes or any of the links on any of the documents, we're still tracking kind of where that stuff comes from. So we know, how to better serve you all in terms of getting the word out and get more students connected. Once they go to either of these platforms, it's very, very simple for them to create an account. They're using single sign-on, as I mentioned before. So their email address and password that they would normally use to log into their email for school. And then there is an intake form. And this is something that I think is really important to make sure that we talk about, is that a lot of times what happens is, we spend a lot of time telling students that TimelyCare is available to them. But in the moment where they're hearing about it, students don't take that step to go ahead and create an account. They think, well, that's great. I like that I have access to this, but I don't need it right now, so I'm not going to do anything. Or maybe they'll even go ahead and download the app on their phone, but they won't create an account. The process of creating an account takes about 5 minutes. So again, by the time that you sign in, you put in a little bit of personal health information, family history, some of these different things that we're asking for in order to be able to have a good background for the student. It takes a little bit of time. And what students don't want to be doing when they do need help is going through that registration process. And so one big takeaway, if you take away anything else from today, is to encourage students to go ahead, even if they don't think they may ever use this, to go ahead and create accounts. Nobody knows when they might wake up in the middle of the night with, really bad stomach pain and you're not quite sure what to do. Wouldn't you rather already have an account created that you can click a button and see a provider quickly than having to go through that process while you're in pain, while you're dealing with whatever you may be dealing with, of trying to create that account and answer questions. So again, one of the biggest things that we can do is just encourage students, as soon as we talk to them about this, is to go ahead and create those accounts. So once they've logged in, you can see they put in their email address. This is a little bit of information that they're going to add, their first and last name. We do support preferred names. So if a student has a name other than their legal given name that they want to go by, we do support that. We also support pronouns. Our providers are all trained in cultural curiosity. They make sure that they're engaging with students in a manner that student feels comfortable with. So even though we may not always be able to provide her that looks or has the exact same background as a student, all of our providers are trained to understand they need to be working with students in a manner that student feels comfortable with. And so there's a number of different ways that we allow students to input information about themselves so that when our providers engage with them, they've got a little bit of information ahead of time to make sure that they're engaging with them appropriately. We again also ask for medical information. So there's a little bit of information there. You can see there's a skip for later as well. So there's a few questions that if students, especially if they're just looking for a mental health support, if they don't want to put in all their medical information, they can just put that skip for later. Just a reminder, they will still have to put it in if they want to have a medical visit. There are some required fields there they would have to go back through. But we try to really streamline the process as much as we can in order to get them to help as quickly as possible. Once they're logged in, the process of going through and creating a visit, the first thing they'll do is click our Get Care button. So you can see we've skipped that first slide because I want to kind of show you what this looks like. Once they click Get Care, this is a list of all of the options that are available to them. So it's broken up based on demand and scheduled. So you can see there's the medical on demand, the Talk Now on demand, and then the counseling, health coaching, and medical options down below that they can schedule. If a student chooses one of our scheduled services, the next thing that will appear for them is a list of providers that are licensed in their state. We also do ask students for their state at the start of every visit where they're currently located. And then based on that, that's how we populate the list of providers. If a student chooses one of our on-demand options, they won't see a list of providers. It will just automatically go into a queue for them to wait for the next available provider. So once a student has clicked on one of these, so anytime that they click on a provider, it actually does expand these little bubbles. That's where they can see the biography of the provider, which is just a couple of sentences, a couple of paragraphs that the provider has written about themselves, as well as their licensure, any areas of specialization, languages that are spoken, things like that. So if the student has found a provider that they feel comfortable with, they can click on their name, and the next thing that comes up is their calendar. One thing I will note is that on this list of providers, these are always going to be sorted by first available. So if you ever hear from students, I went to TimelyCare and, they didn't have any providers that were available for, 3 or 4 weeks. Well, that is something that one should never happen. And if you hear that feedback, let us know. But the other problem that sometimes will happen is students will scroll down this list, looking through all the different providers to find somebody that they feel comfortable with. They might pick somebody that's, 2 or 3 scrolls down. Well, that person is down further on the list because their availability is further in the future. If the student's top priority is to see someone soon, they'll probably want to stick with one of the first providers in the list. So, there is a point at which they're going to have to prioritize, what's more important, finding the exact provider that I want, or, seeing somebody super soon. But at the end of the day, we do have options, hopefully where students feel like they can, have both of those needs met. Once a student has booked their appointment, it shows up in their app. And then we also send a lot of notifications. Anytime that a student schedules a visit, we want to make sure that they actually show up, both for their own benefit, as well as making sure that we're respecting the time of our providers. And so any communication methods that students have allowed us to use to contact them, so that can include text messaging, emails, as well as in-app notifications. We'll send multiple reminders to these students to let them know that their visit is coming up. They can even, within the context of a text message now, this was a fairly new feature. If they, maybe they get a text message 24 hours in advance and they realize, oh no, I can't make the meeting, they can actually cancel it right there by just clicking a button right there in the text. So try to make it really easy for students if they do need to reschedule or they can't make their visit, that they can do that, but also reminding them of any upcoming meetings that they have. And then once a student has started a visit, this is what it looks like. So particularly for if it's a phone visit, it's literally just happening on your phone. The provider is going to call the student and they'll just talk via regular phone call. But video visits have a few other options. So the student can see the provider on the screen as well as themselves. And then across the bottom of the screen here, you can see some of the additional options that they have. So they can attach an image. So this could be a file, it could be an image, it could be anything that the student feels like could be relevant to share with the provider as a part of the visit. They can chat. So we don't support chat only, but if a student is having trouble, hearing, they've got connectivity issues, or they need to type something out to make sure a provider understands it, they do have the option to chat while they're talking. Obviously, that's just the hang up button. Students can toggle their microphone as well as their video. And then over here on the right side, we also have this third-party feature. So if a student wants to add any additional individuals onto the call, they can do so. So we only support up to 3 people. So the provider, the student, and then 1 additional person. So this could be if a student, would prefer to have, an RA or a family member or a friend or even a staff member at the school who maybe they just feel more comfortable having a third party there with them, they can invite them. And the way that works is just an email link. So when they click the button, they'll be offered the option to input the email address of the person they want to add. And then we send that person an email with a link, very similar to just like WebEx or Zoom. They click the link, it opens up the portal, and then they can have the visit and be there with the student. So before I jump into this peer community, any questions about how visits take place or how students get connected to the platform? Anything about just sort of that general user experience?
Nope, no questions.
All right, fantastic. So one additional feature, so this is something that's fairly new for us. It's only been out about a month, but I wanted to make sure that we touch on it, is our peer community. So one of the bits of feedback that we have heard over and over from schools is, how can we better find ways for our students to help each other? And that is where the peer community was born. It's very much like a Twitter feed for mental health. When students go into the portal, they'll have the option to add posts. They can write about anything that's on their mind. They can ask questions, talk about experience that they're having. They can choose a category for their post. So, if it's related to a specific topic or type of thing, they can choose a category. And then all those posts show up in a list where the students can get feedback. Fellow students can, heart those visits. They can also, or those engagements, they can also comment on them. all of this, the first question I always get is, how is it moderated? And the answer is very, very heavily. All of the posts before they go through, whether it be an initial post or a comment, are filtered through a list of over 4,000 words and phrases that we filter for both hate speech, inappropriate language, or even high acuity issues like suicidality. So if a student posts anything like that, we're going to quarantine it. It immediately goes in front of our care coordination team that I mentioned earlier. That's one of their responsibilities, is to monitor these posts. If a post gets flagged for a reason, maybe it was just taken out of context, but everything's good, they can approve the post. Or if it's maybe a student who's having suicidal ideation and they're posting about that, that's not something we necessarily want to go into the peer community flow, but we want to have a provider who can reach out to them. So we would at that point escalate to one of our providers. So this is all completely anonymous in terms of students talking to each other. But on the back end, we do know who these students are. So if a student expresses anything of concern, we can then call them, follow up with them to make sure we get them the help that they need. So this can also be a great escalation point for students who maybe aren't quite ready to jump on and have a visit with one of our providers, but maybe using the portal. We can kind of monitor that and identify if there is a need to get them additional help. This is all 24/7. Again, it's moderated 24/7. It's available to students around the clock, and it's a great way for them to get additional help. I will say, from having kind of looked through some of the posts on here, one thing that surprised me a bit was just the consistency that relationship issues came up with. A lot of times when we look at the reasons for more of our mental health visits, it centers around anxiety, depression, and stress. But the number one topic right now within our peer community platform is relationships. So a lot of students posting about challenges they may be facing, getting feedback from each other, talking through those issues. And it's a very, very supportive community, very, very cool way for students to help each other out. And then the last thing here, I mentioned our self-care content. So just wanted to give you a quick overview of what that looks like. So within the app, it's just in a button that says Explore, and that is where students can see videos, articles, self-care content, a number of different mediums to consume content that relates to issues they may be dealing with. As I mentioned, our providers can recommend specific resources for students. And we're also about to launch something called Care Journeys. And what Care Journeys are is basically curating content. So we have a lot of different videos and articles and things that are there that students can browse, but we want to create pathways. So again, if a student maybe is dealing with anxiety, how can we feed them specific content that is around anxiety and around managing anxiety that they can consume consistently to help deal with the symptoms of that issue. So a great way for them to use that. Fantastic resources here for students. We've got a great team of content creators. This library is growing considerably. There's a lot of really good stuff here. And then the last thing that I wanted to show you here is that we also have a specific line for faculty and staff support. So I mentioned earlier that our resources are only available for students, but we also want to make sure that you all as faculty and staff have the support that you need when you do run into students who maybe need the additional help. And so that is where this 18334 Timely came in. You can call this number at any time, just like with students, it's monitored 24/7. But if you have a student that you want to talk to an issue about, so again, it's not for your own mental health, your own medical help, but if you are seeking help in how to deal with a student issue, that's the purpose of this line. So you can call in, you can talk through, issues related to specific students, issues. I had one the other day. We were talking about, if you have a student and maybe they've expressed some concerning behaviors, and you're just not quite sure about how to recommend to them that they seek therapy. That can be a tough conversation. And so you could call into this line, talk with one of our therapists. They could give you some guidance on, maybe what are the right, maybe things to stay away from, as well as, maybe specific language that you can use to broach this topic and maybe point that student in the right direction. So again, a great resource that you all have access to. It's just that call in line. Definitely encourage you to check that out. And that is all that I have today. My information's up here on the screen. I'll also be sharing all of these slides with Alexa. She can share those out with you all to check out. I know that there also is, the recording of this video is going to be shared with the group. And again, I'm Andy Fenton. I don't know if I even said that at the beginning. I know Meredith introduced me, but I am the client success manager. My entire goal is to ensure the success of our platform for your schools. So definitely encourage you to reach out to me directly. I am a resource for you specifically at Three Rivers. So anyone at the school can contact me. I'm not just here for leadership. If you have questions, I'm here to answer those. Drew Howard wasn't able to make it today. He's the client success associate that I work alongside of. So if I'm ever unavailable, he's always my backup. He's another great resource that you have access to. So again, thank you all for having me today. And if there are any questions, happy to field those, or we can wrap things up.
I did have one question. So with the peer community, I know that they're giving each other advice. You said about things like relationships. Do counselors pipe? What happens if the advice isn't great? Or is there somebody? I know there's a lot of monitoring of the conversations.
Yeah, absolutely. So there's a couple different ways that can get caught. So one is, we do monitor it. We have people looking through it. They can even, some of our providers can even post themselves if they see something maybe they feel like they could chime in on and add some value to. It's still anonymous. They're not pointed out as, therapists on there, but they do have the ability to post. They can also reach out to the students directly. If somebody, again, as I mentioned earlier, is expressing concerning behavior as a part of the peer community, we have methods to reach out to them. It wouldn't show up in the feed. So it kind of happened through a back door where we'd reach out to them directly. But students can also self-monitor. So if a student were to notice that maybe a peer was giving bad advice, maybe saying some things that weren't very helpful, or just not appropriate, or whatever the case may be, they can also flag each other's content, which again moves those posts into quarantine. If something was flagged inadvertently or it's still deemed appropriate by our team, it can still get added back in. But students do have the ability to flag each other's content as well if they feel like there's things there. So there's again, several different ways in which those sorts of things would be caught.
Thank you. That makes sense. So I want to thank you so much for coming out and talking about this resource. It's an incredible things that our students can access. And so these slides will be available. The whole presentation will be available. So this is a fantastic resource for the whole community, and I really appreciate you coming out and speaking. So thank you, Andy.
Absolutely. Thanks for having me.
All right. Have a wonderful day.
You as well.